So first of all, thank you to everybody for inviting me. So I'll be talking about the scourge of retinoblastoma, and I have no financial interest to disclose. So coming to the retinoblastoma is one of the life-threatening causes of leukocoria. We all know that, and retinoblastoma is one of the most common intraocular malignancy in children. So the reported incidence ranging from one in 15,000 to one in 18,000 live births, second only to uveal melanoma in the frequency of occurrence in malignant intraocular tumors. So there is no racial or gender predisposition. It is usually bilateral in about 25 to 35% of cases, and the average age of diagnosis is usually around 18 months, whereas in unilateral cases it's 24 months, and bilateral cases it's around 12 months. So the incidence of unilateral non-heritable disease is increasing, especially in developing tropical and subtropical countries. There are various theories as to why it is happening. Some authors state that it could be due to viral etiology. Some could state that it could be due to dietary influences in pregnancy, but it could also be due to better diagnostic and screening procedures. So coming to the genetics, so the newly diagnosed cases usually 6% are familial, whereas 94% are sporadic, whereas bilateral retinoblastoma usually germline mutations in all cases. Around 15% of unilateral sporadic cases caused by germline mutations affect only one eye, whereas 85% are sporadic. So here in this chart, there is around showing the distribution of cases of chances of occurring in different population if the parents do or have retinoblastoma versus if they don't. So as you can see, people who there is higher chances of having if there is a positive family history. So this chart shows the various modes of presentations of retinoblastoma, leukocoria being the commonest, followed by strabismus and red painful eye. So the reason, so in a children in the first, it can present retinoblastoma present in various ways. So whenever we are seeing a child, we have to keep this in mind. So while coming to the examination, it has to be has meticulous history taking because the child usually is very uncooperative, and visual acuity measurement has to be done very carefully, and thorough examination including in fundus exam. We have to make sure if possible we have to also take photos, and if sometimes if the children is not very cooperative, we have to examine under anesthesia, because the examination of the entire retina, especially up to the periphery, is very important. So it is also very prudent to evaluate the siblings and also the parents if possible in the same setting, and if not, then as soon as possible. So coming next to the imaging, so ultrasound should be done for both the eyes. To sometimes very small tumors in the periphery, we should not miss them. So MRI is a very important investigation to really assess orbital as well as extraorbital extension. It is very sensitive in distinguishing between other forms of leukocoria. Currently, it is one of the investigations of choice. So CT scan is not very advisable nowadays because MRI is ubiquitously available. So if MRI is not at all available, so we may thinking about CT scan, but usually MRI is more preferable. So we need to do invasive tests like lumbar puncture, bone scan, PET scan to rule out METs. So the goals of the treatment are usually the first one is to save life, second to save salvage of organ and dysfunction, and the tertiary one is the avoidance of side effects. So it requires a multidisciplinary approach along with the pediatric oncologist, the radiation oncologist, and oculoplasty specialist, the retina specialist, etc. So the treatment option, we'll quickly go through that. Main are the focal treatment, the chemotherapy, and the enucleation, and the external beam radiation therapy, which is not usually not used very commonly nowadays. So focal therapy can be cryotherapy, which is usually done at 4 to 6 week intervals, and it can also be used with intravitreal chemo to reduce iatrogenic tumor seeding. So the complications can be transient serous RD, retinal tear, and large scar. So another form of focal therapy is the transpupillary thermotherapy used with a diode laser, causing cytotoxic effect to tumor cells due to heat. and combined with chemoreduction for larger tumors, complication can be focal iris atrophy, peripheral cataracts, retinal traction, and RD. Another forms of is plaque brachytherapy, implantation of radioactive material on the sclera of the base. It can be done with iodine 125 or ruthenium 106, and the complication in use include radiation retinopathy or optic neuropathy. Chemotherapy can be used in various ways, that is intravenous, intraarterial, intravitreal, and periocular. So intravitreal chemotherapy is usually two, three, or four drug combination regimens. The common drugs that are used are carboplatin, cisplatin, etoposide, cortican, etc. Adverse effects like other chemotherapies is usually bone marrow suppression, neurotoxicity, hyponatremia, nephrotoxicity, etc. And another is the intraarterial chemotherapy. It is a very target specific chemotherapy. So that drug is usually delivered to the ophthalmic artery. So the advantages are reduced amount of drug required, and the side effects are reduced. So has greater success rate compared to intravitreal chemotherapy, which has been seen in different studies. The adverse effects are vitreous hemorrhage, BRAO, ophthalmic artery spasm, ophthalmic artery obstruction. But what has been noted by different authors is that the most complication reported with intraarterial chemotherapy is usually related to the technique. So properly done intraarterial chemotherapy has really got very minimal adverse effects. So enucleation is one of the gold standard therapies for advanced intraocular retinoblastoma. So we have to cause minimal glow trauma while growing it, a long optic nerve section, histopathological examination, of which if shows scleral invasion or orbital extension or content of the optic nerves, we should treat it like orbital retinoblastoma. We have to take steps to prevent bony deformity in the form of orbital implants, along with the oculoplastic surgeon, so that when the child grows up, the orbit is not really a contracted socket. So external beam radiotherapy is not really used nowadays. So it's the last resort for globe salvage prior to enucleation. Complication can be mid-facial hypoplasia, etc. So prognosis is usually very good if treated before extraocular spread. Degree of optic nerve spread greatly changes chances of survival. Distant site metastasis carries poor prognosis, whereas pinealoblastoma has a very poor prognosis. So there is a controversy regarding cataract surgery. Different authors have said this is a very safe procedure, so you can approach it in any way, but it has to be done in a period of inactivity. Some authors suggest a minimum of 16 to 18 months of inactivity after that. Posterior capsule removal to be done on case-to-case basis, and follow-up is usually first 6 months, 4 to 6 week interval, 3 years, 4 to 6 monthly intervals, and later yearly. With a positive family history, all members should be examined yearly. Genetic counseling is very helpful, can detect exact mutated gene, can also use in siblings and parents to detect germline mutations. So the take-home message is keep an index of suspicion, as it can present in any manner. Refrain from unnecessary invasive procedures. For example, do not drain a hyphema without investing, or a vitreous hemorrhage, and timely referral, follow-up, and coordination with the oncologist. Retinoblastoma is one of the most curable pediatric cancer.